Well, this is my son and me, both together with brackets, and this is one of my first handy tips for you. I'm not here for for research, only for a practitioner, and give you some tips. First thing is, please wear this appliance you gave to your patients and feel the pain they get. We have had a public opinion poll several years ago, and they found out that we have 80% attractive in a patient. This is very good market for us because when you see, we were asked mostly in our practice about 3 to 3, social 6 corrections, but the German market still is in trouble because we lost our children more and more, and maybe we have to decide more to treat the adults. So this is our market and future market as well. Leonardo da Vinci, now 500 years ago, died. He gave us some good pictures here, Il Vecchio, Il Giovane, the old one and the younger one. And of course, it is a pseudoprogenitor because the loss of teeth. But all here around living other class 3 people in these times, there were the family Habsburg, Maximilian I, his son Philip the Fair, and the other emperors later, Charles V and Ferdinand I. They were real class 3, open bite. Okay, cases like this I won't treat with clear aligner. They have to get surgery with brackets, of course. Clear aligner, something to repeat to the former presentation by Pablo Chari. So the CA lab from Shaw is now established since 2011. Since 2012, we have now CA Digital. Both systems are working on the movement, comparing from the former and the later position, and then we have to produce the aligners. The clear aligner schema here, you see, we work on every week during this 3-week period, from the first one with CA soft in 0.5, the 0.625 called CA medium in the second week, and the third week 0.75. The range about the movement is 0.5 millimeters in the first step, and after the second step you move every tooth around to 1 millimeter. And Pablo tells us the patient has to wear the aligners around 18 hours, that's right, but my experience in the practice is if I say 18 hours, I only get 12 hours. So I tricked them and I gave them the 24-hour wearing times, so that I get 20 hours around, so that's enough for me. Only in the first phase, in the first 2 days, I tell them they only have to wear them for several weeks a day because the pain increases, and so after 3 days it's okay for the patients to accept the wearing them. These are the other planes where we treat them. The 0.5 is the horizontal plane, the occlusal plane, and the other, the vertical dimension, it's only 0.5 millimeters and every time. And also the rotation, if you only move the teeth by the aligner, you aren't allowed to do it more than 3 to 5 degree rotation and the tipping of the crowns, because they won't fit as well and you won't have so good results and the reaction. And also Pablo told us that we have a phase 0 without any align setups. There we can do the expansion with the Vector 40 screw, like you can see here on this screen. we have this vector 40 screw, and after that we opened here in a trimmer for getting now the expansion space for the canine now came in. And after then, maybe you can also make a screw here for distalization, but you also have to keep an eye on the anchorage, and you can see here the buttons for the class 2 supporting anchorage. And it works like this. Sharon told us about the 3 points. These are which were very important for the aligner treatment. You need force, space, and time, and the space is the most important one. You need the approximal freedom to have any correction like the aligning, because if you don't do this, the movement of the teeth will be interrupted because they can't move. So we start now keeping an eye on the crowding correction, because all these cases you later see, they were crowding corrected cases in class 3. If you correct crowding, the most and easiest thing is protrusion and expansion, of course, but if you're doing this, you can install this black triangle phase, because Tano did some research on it, and if you have a distance between the crystal bone here and the contact point from more than 4.5 millimeter, you get loose the papilla here. So it's better to shape the teeth and bring them together for regrow up the papilla. So here you can see a schema from this crowding, and if you imagine a full half circle around this contact point area, if we protrude and expand, we can go to this half circle. So you create more space in this time in this chapter here, and then you get the inspection the space for the alignment. But interesting is the lower jaw occlusion plane here. This is the contact area, and when we make the class 1 occlusion there, then it's perfect, of course. But if you have crowding here and you want to correct it, then it's important to have enough space to do this. Especially when you have class 2, it's much more easy because you have more space to protrude it, of course. But class 3, then you get in trouble because you can get later in edge-to-edge relation. So this is why we have here sometimes problems. You can give to the patients class 3 elastics, you can do strippings in the lower arch, or gaining space in the upper, maybe when you have Bolton discrepancy and you want, and you have also some veneers or something other things for the dentist to do to help you there. So let's get back to stripping, like Pablo shown us before. I go through. So when you strip here and bring it together, so then the papilla can grow up. So that's conclude us to the final space analysis, and the red market fields shows us the normally clear liner correcting movements like protrusion or retrusion of lateral expansion or uprighting, and the stripping of the in the frontal area. So the first case I show you is a lady in the age of 61. She has some small crowding in the lower jaw, and we did some diagnosis on her. She has 2.5 millimeter in the lower jaw, totally space, crowding, sorry, and as well an edge-to-edge relation from 1.1 to 4.1. So we create a little bit space in the upper, but also in the lower. And we plan to strip as well here. So this is the end situation. She was wearing these aligners also and also we stripped on it, and we come from here over there up to this position. Okay. The next case is a class 3 and severe crowdings, but the overjet was poor, and I asked him to wear class 3 elastics, but unfortunately he didn't do this, and I didn't have the success I expect to have, so we end up here. It's poor, of course, I know, and I convinced him to continue the treatment with some stripping or other things, but he avoided to do this. For him it was perfect, not for me, but I end up here. Okay. Yes, that's live, of course. Another class 3 case with also severe crawling and a frontal crossbite. He was here, he came around, but his motivation was very, very high. So we also do the same thing. He has a class 3 half unit and a crossbite here from 2.2 to the 3.3 to 3.2. And then we decided to come from here to here and from here to here. So some expansion and some protrusion. And the class 3, he did a good job on his aligners and on his elastics. So he end up here. And so you can see the uprighting of the lateral incisor. And the last case, he is very strong class 3. We have here the 4-1 behind the other tooth. He has a 3/4 unit class 3. Here as well. And we decided to, because he has only 3.5 millimeters here and 2 millimeters here, we decided, depending on this strong class 3, to extract one tooth. He's very vertical, you can see. So, before and after. So we have here our plan to do the extraction here, give some little expansion and protrusion in the upper jaw, and some retrusion because we gain more space than we need in the lower, of course. So, and that's why we end up here. He had the class 3, and he got the retention fixed retainer and also some removable retainer. Conclusion. So what's very important in our class 3 treatments? The first thing is, of course, you have to do a good diagnosis and treatment planning. And in this, during your treatment planning, you need also to install all your supporting tools as well, and during your treatment you have to use them very well, and you have to motivate and re-motivate very, very, very well your patient, because if they don't wear maybe your class 3 elastics like you see, then you didn't get your result you want to expect. Okay. So, I'm very I'm very thankful for being here. And again, if you have any questions, don't hesitate.
Later. Questions later.
Okay, have a nice weekend. Thank you very much.
Knut, for the camera.